Hello, guys. I'm Shamdata Chakraborty from Department of Psychology, and I'm here to give you a little insight on stress and coping of stress. How can we manage stress better? So I hope this video will be helpful to you all to get an insight on how to manage stress and what is stress, like how do we define stress, and so on and so forth. So let's get started. Give me a minute till I share the screen so that you all can view it. Yeah. So, what is stress? The first thing, what is stress? Stress is a normal reaction to everyday work. Now, stress is, you could say it's a way of emotion in a way, because how do we define stress, right? So, stress could be put under pressure, our daily work pressure, when we have an assignment to finish, when we are in the pressure to finish the assignment. So, stress is a normal reaction to everyday pressures. But when it becomes overwhelming, when it becomes unhealthy, and which further affects your day to day life, that's when we need to know that, okay, this is the time we should probably be more concerned about it. Because as long as the stress is good, the stress is making you work better, give your best, it's fine. That is manageable. It's under your control. But when this feeling or the reaction becomes overwhelming, where you cannot handle it in a way that you would like to otherwise. So we will be talking about it more and in more detail. So let's skip to that. So, and stress management encompasses techniques intended to equip a person with effective coping mechanisms for dealing with stress. So, stress management is nothing but what we could do to handle it, to control it better, that it does not affect our day-to-day life in other ways. Now, there are two types of stress: eustress and distress. So eustress is basically the stress that helps you motivate, that is good stress, in simple words. Distress is bad stress. Now, there are certain aspects to it, like impact on perception. First perception, if you know, like if you take the first thing. Now, negative threat, like in the category of distress, negative threat would be something that is harming your mental peace, which is not acting good in your life, which is something that is pulling you down. Wherein eustress is positive challenge. When you are a little bit stressed and you perform better, that's a positive challenge, because you know, I have to do this today and I have a little bit of pressure on me, but that is helping me do better. That is the positive challenge. Impact on emotions. In case of distress, you will feel anxious, palpitation, you know, you will constantly be worried. But in case of eustress, you will be excited. You know, when we first open our, say for example, you want to open a cafe, you have a stress of putting a good cafe, you know, something that should be liked by everyone. But you also have excitement, you have stress, you have pressure of, you know, making it work, but it gives you an excitement. So that's eustress. Impact on your productivity. In case of this stress, you're going to procrastinate more. Rather than doing or executing the work that you're supposed to, you're going to work more on, okay, I should be doing this. You know, how should I do this? Am I right for this? Am I fit for this? That is procrastination, right? But in case of eustress, the pressure is going to motivate you to do better, to work better. Now, in case of impact on your performance, in case of distress, it's going to pull you down, which is diminution. But in case of eustress, it's going to enhance your performance. It's going to help you perform better. All right. Now, the stresses. Stresses are nothing but the stimulators, something that triggers your stress, something that reaches to the threshold where you seek external support, or so on and so forth. Like a stressor is a chemical or biological agent, environmental condition, external stimulus, or an event that causes stress to an organism. Psychologically, if we speak, a stressor can be events or environments, as I already explained earlier, that an individual would consider rather demanding, when you cannot be happy about the circumstances because there's something that's very challenging, or it is, threatening to your own safety or your own concerns. Now we'll go a little bit deeper into acute stress and chronic stress. Now there you can divide stress into two parts. Those two parts would be acute stress and chronic stress. Now chronic stress is the bad stress, acute stress is the good stress. In case of chronic stress, you will have, something, if we talk about some incidents, then it could be something that is working against us. We are trying to do very best, we're trying to give our very best, but somehow it's not working out. And it usually lasts for a very prolonged time, long phases. And it could further lead you to many issues, both physical and psychological. Bad relationships could be a reason, work environment could be a reason, poor sleeping habits, toxic surroundings, or being in a drama triangle, like your relationships with people or being in a very toxic environment could lead to chronic stress in the long term. And physiologically, cortisol hormone hangs out with the insulin hormone in the stress. Now, cortisol is our stress hormone. And in case of acute stress, it usually works in our favor because, as we already discussed, it motivates us. It's pressure, yes, but this is the kind of pressure you need to work better. As we often say that people work better under pressure, but that pressure should not exceed to a point where you're not able to perform. It should be something that motivates you, challenges you in a positive way. That is acute stress. It is very short period, one assignment or one presentation sort of leads to good fat loss, good workouts, weight training, intermittent fasting, new chapter of life, new milestone. These are the good stresses which can come under acute stress. And in this case, physiologically, if you have to speak, cortisol hormone hangs out with the human growth hormone in this particular aspect. Then we'll go on to what are the chronic effects of stress. First one is structural alterations in the brain induced by chronic stress, possible memory correlates of these alterations, dendritic atrophy and reduced neurogenesis in the hippocampus, impaired hippocampal-based spatial and declarative long-term memory, dendritic atrophy in parts of the prefrontal cortex, impaired walking, short-term memory, increased dendritic spines and increased corticotropin releasing hormone in the amygdala, increased fearfulness, proneness to depression, enhanced fear conditioning. So when we are under chronic stress, our emotions get altered, talking about amygdala. Then we have problem in memory, perception, decision-making. So these are some of the things that could be taken under consideration when you're in chronic stress. Now, further, in the next slide, we're going to discuss about what are the symptoms. What are the symptoms that we need to look forward to when you're under stress? All right. So stress warning signs and symptoms. So we can divide it into four parts. One is cognitive, emotional, physical symptoms, and behavioral symptoms. So in case of cognitive symptoms, what we can look forward to is memory problems, inability to concentrate, poor judgment, seeing only the negative, anxious or racing thoughts, constant worrying. Emotional symptoms could be moodiness, irritability or short temper, agitation, inability to relax, feeling overwhelmed, sense of loneliness and isolation, depression or general unhappiness. And in case of physical symptoms, we can notice aches and pains. When you're under stress, it is very normal to have constant back pain, constant pain in the legs or in the calf muscles, neck pain, headache, something of migraine, diarrhea or constipation, nausea, dizziness. When you're under stress and you are not able to move, you constantly feel lightheaded, or you cannot, walk better in the circumstances. Chest pain, rapid heartbeat, again palpitation, loss of sex drive, frequent colds. In case of behavioral symptoms, eating more or not eating at all, which is binge eating. Some of us usually under stress, we eat a lot or we don't eat at all, which is a very common symptom that we see. Sleeping too much or too little. Oftentimes, we try to ignore our stress or ignore the circumstances by completely escaping the situation. That is also one of the symptoms that you could look out for. Isolating yourself from others, procrastinating or neglecting responsibilities, using alcohol, cigarettes, or drugs as a method of escaping the reality. Nervous habits like nail biting, pacing, constantly going around. These are some of the symptoms that you could look forward to while you're looking for symptoms or while assessing something with stress related. Now, what is coping? Again, the coping is proactive coping. If you talk about, is like a stressor. When induced, first, what do? Acknowledge the stress, acknowledge the stressor. Then the appraisal of stressor. Appraisal is basically how you react to your stress. Primarily, you're going to find, okay, how am I going to see it? Is it something emotional or is it something problem focused? Secondary, how are you going to work on it? Is it an attack? How is it threatening you? Then there are two things that you could do while appraisal of stress, like while you are coping, trying to cope with your stress. One is problem focused coping, one is emotional focused scoping, as I explained. Then some of the coping skills that we could use in our day-to-day life that would help us in the future to be more relaxed, to be able to work better. So some of it could be meditation, exercise, journaling, drawing, listening to music, walking, speaking to a friend, sleeping, yoga, cooking, whatever makes you happy. Basically, coping is to distract you from the stressor. After analyzing your stressor, then you can walk through, okay, this is something I have to face. Then you break it down into pieces and see what is the first thing that you need to work on. Is there a problem? Or is it completely emotional? And if you choose the emotional way of coping, then you can take a step back, try to relax. Now, whatever makes you relax, meditation could work for you, exercise could work for you, enjoying nature could work for you, a little walk in the park could work for you. So these are the things you can do to cope up with stress. Now, in the next slide, we're going to talk about two disorders mainly: acute stress disorder versus post-traumatic stress disorder. So when we talk about acute disorder, the onset starts from 0 to 28 days after the trauma has occurred. Duration, it lasts between 3 days to 4 weeks, not more than that. Symptoms could be depersonalization and derealization. So if I have to put it in simple words, basically, am I worth it? Am I doing it right? What am I doing? What is the motive? These are the things you could see in this. And treatment could be short-term psychotherapy and antidepressant medication if and when prescribed, if and when required by a psychiatrist. Post-traumatic stress disorder, onset is at least 1 month after the trauma occurs. It is like it shows after 1 month of the incident that has taken place that could have marked in your memory as a very tragic incident or something that you cannot deal with at that point of time. Last at least 1 month and can persist for several years depending on the intervention. If it's treated properly, if not, if you have sought help at the right time. Symptoms, avoidance, heightened awareness and changes in mood or cognition. Treatment could be long-term psychotherapy, medication, and EMDR therapy. Some of the coping strategies, again, stressor, coping strategies, academic satisfaction, academic dissatisfaction. Both could be your stressor. In case of academic satisfaction, it's going to be positive coping strategies like positive reprisal, planning and resolution. In case of academic dissatisfaction, it will be negative coping strategies, which is denial of problem, distancing from the situation, distraction, or acceptance or resignation. Now I will briefly tell you what are the things that you could do in order, like when should you seek help, right? When do we know that this is getting to a point where we need external people to hear us out? Now, when all of these, after trying to do, you are still not able to control your emotions. You are still getting overwhelmed. You're still getting anxious. You're still worried. That is when ideally you should seek professional help. Before which, acceptance is very important. You need to accept, or you need to understand, as we spoke earlier, that, okay, this is something I'm not able to control. This is something I'm not able to work on alone. Maybe somebody else would help. Now that somebody, your first could be your parents, could be your friends, could be anyone close. Now, when you talk to them and you realize, I would require a professional help, Or it would be better if someone professional helped me guide through the coping strategies or how to manage stress better. That's when you should go to a counselor or a psychologist as and when required. So I hope this video helped you guys understand it, stress, coping strategies, stress management a little better, and it will be helpful to you in the future. Thank you. Have a good day.